1. Introduction. RAWSEP view. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable. Wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove, and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP view. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to Residents Against Wood Smoke Emission Particulates and their concern for air pollution from indoor residential wood burning. Residents Against Wood Smoke Emission Particulates, or RAWSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this RAWSEP podcast will be news about air pollution from indoor residential wood burning and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, Residents Against Wood Smoke Emission Particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025, and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives, and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Webisode 57DHXXQ September 22nd, 2025 on September 24th, 2025 the Climate Forward Conference in NYC. In Webisode 57DHXXQ 1 notes from Day 2 of the RFK Junior CDC ACIP meeting plus legal expertise from Professor Dorit Reiss 2 Climate Week as the United States pulls back on September 24th, 2025 the Climate Forward Conference in NYC. 3 These patients got the cure then it went away. Gene therapies for rare diseases are frequently developed but then discarded by drug companies because they cannot afford to produce the treatment for more patients' main content. When I moved to reconsider notes from Day 2 of the RFK Junior CDC ACIP meeting plus legal expertise from Professor Dorit Reiss Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization inside medicine by Jeremy Faust MD September 22nd 2002. On Friday, I watched most of the second day of the CDC Advisory Committee on Immunization Practices meeting. Below is some follow-up on some embarrassing shenanigans left over from Day 1 and some fresh nonsense from the Day 2. My thanks to Professor Dorit Reiss of UC Law San Francisco for her major contributions to this piece. On Friday, I wrote that the RFK Junior just installed Advisory Committee on Immunization Practices ACIP at the CDC was so ill-prepared for its task that it did not even know what it was voting on. I know that some of you thought this was hyperbole. It was not, nor did the votes they cast have internal consistency. On one hand, they recommended against the MMRV measles, mumps, rubella, varicella vaccine for children under age for saying that the MMR components should be given separately from the V component. Then they voted to maintain obligate funding for said vaccine for the National Vaccines for Children program. This literally made no sense. They voted against a vaccine, then moments later they voted in favor of funding that same vaccine. In the hours that followed there was speculation over how the lawyers were going to deal with that one. However, sometime between the Thursday vote and the convening of the Friday meeting, the committee indeed figured out that their votes contradicted each other. So, as the first order of business for the Friday meeting, there was a motion to reconsider the second vote. All of this came off as very professional. I assure you it is no surprise that on the revote the committee decided to take away the funding, so at least now the committee bad policy makes sense, if only from the standpoint of Aristotelian logic. The committee also voted to table its attack on recommending hepatitis B vaccines at birth because they could not seem to agree on the science. It is actually pretty simple, but the new members do not much about the topic, which might beg the question as to why they are voting members of our top vaccine panel in America, but we digress. To their credit, they realized this before taking legally binding votes on the matter. Yay, here are some links to overviews of what happened. New York Times coverage highlights include quotes from Doctor Jason Goldman, representing the American College of Physicians. Goldman repeatedly led the charge against this committee, emphasizing that the usual evidence to recommendation framework had been abandoned and decrying the exclusion of experts from the workgroups because RFK Jr. thinks that expertise is a conflict of interest, basically MedPage Today opinion. ACIP is now obsolete. Here is where medicine can look instead by Dr. David Hackney Expert analysis from friend of Inside Medicine Dr. Atul Gawanda. 3 of the 4 votes were literally outside of the ACIP legal purview. Expert legal analysis from Professor Dorit Reiss. For the remainder of this installment, I want to focus on the bizarre spectacle that unfolded when the committee turned to its discussion of COVID-19 vaccines. ACIP voted on 4 issues related to COVID-19 vaccines. Now first, it bears repeating that the language of these votes was not published in advance, which is a major violation of norms. For example, laws, as the outcomes of these votes determined thanks to the Affordable Care Act. What vaccines private insurers must pay for a transparent process involves giving the public and stakeholders ample opportunity to contribute expertise well in advance of the votes. That norm has been chucked in favor of a process by which the language, as we heard, still being negotiated during the meeting. Here is the language that the CDC posted on Friday. Vote number 1. It is the sense of the committee that the CDC engages in an effort to promote more consistent and comprehensive informed consent processes, and as part of that considers adding language accessible to patients and medical providers to describe at least the 6 risks and uncertainties included in the WG Workgroup Chair presentation. Vote number 2. It is the sense of the committee that state and local jurisdictions should require a prescription for the administration of a COVID-19 vaccination. Vote number 3. It is the sense of the committee that in conversations with patients before COVID-19 vaccination, authorized healthcare providers discuss the risks and benefits of the vaccination. For the individual patient, the discussion should consider known risk factors for severe outcomes from COVID-19, such as age, prior infections, immunosuppression, and certain comorbidities identified by the CDC, and include a discussion of the potential benefits and risks of vaccination and related uncertainties, especially those outlined in the vaccine information statement, as part of informed consent. Vote number 4. The pediatric and adult immunization schedules for administration of FDA-approved COVID-19 vaccines should be updated as follows: adults 65 and older vaccination based on individual-based decision making, individuals 6 months to 64 years vaccination based on individual-based decision making, with an emphasis that the risk-benefit of vaccination is most favorable for individuals who are at an increased risk for severe COVID-19 disease and lowest for individuals who are not at an increased risk according to the CDC list of COVID-19 risk factors. Before bringing in Professor Dorit Reiss, I just have to mention that the language here is embarrassingly unprofessional. It is the sense and considers adding RA little murky, shall we say. When ACIP assembles to vote on national vaccine policy, the language must be narrow, clear, and easy to interpret. What does any of this mean for a physician on the front line? It is not even clear what this means for CDC scientists who have now been directed to consider doing something. It is sloppy. Enter Professor Reiss of UC Law San Francisco. She is one of the leading experts on vaccine law, so I asked her to again contribute her expertise on this newly broken process. I am grateful she shared her insights with the Inside Medicine community. Here are her comments in a Q&A format. Edited lightly. What are your overall reactions? The most practically important thing was the last vote on this. ACIP voted unanimously for shared clinical decision making for everyone, though they made a distinction between people over age 65 and those under. This is a much weaker recommendation than the prior one. Obviously, what does this mean? It is good and bad. Nobody quite understands what shared clinical decision making in this context is, but practically it means two things. Shared clinical decision making is in contrast to routine recommendations, so it is an opt-in instead of opt-out. The doctor should initiate the conversation, but not all of them will do that. That framework leads to less uptake, partly because nobody is sure what is required. I think insurers should cover vaccines recommended under shared clinical decision making, but they do not always. With eyes on insurers now, I think most will cover the COVID-19 vaccine, but some may not, and it could change over time. What about Medicaid? What will private insurers that are not part of the AHIP, American Health Insurance Plans Association, which has said its member organizations will cover COVID-19 vaccines, do? A press release from HHS announced that federal Medicaid plans will cover COVID-19 vaccines. That was emailed to me, so there is no link, but here is the relevant language. Individual decision making is referred to on the CDC adult and child immunization schedules as vaccination based on shared clinical decision making, which references providers, including physicians, nurses, and pharmacists. It allows for immunization coverage through all payment mechanisms, including entitlement programs such as the Vaccines for Children program, the Health Insurance Program of Children, Medicaid and Medicare, as well as insurance plans through the Federal Health Insurance Marketplace. On the plus side, it is better than if ACIP had wholly unrecommended the vaccine. So there is still likely to be coverage for everyone who wants one except those who are pregnant. Note, unlike Medicaid, Medicare has to cover COVID-19 vaccines no matter what ACIP might say. That is due to other laws. Can you get a COVID-19 vaccine at the pharmacy still? Or will you need to go to the office of a doctor or a clinic? My understanding is that pharmacists can give vaccines recommended under shared clinical decision making. It is a recommendation. Now the other three votes, these were odd because they did not really appear to fall within the remit of ACIP. The ACIP job is to recommend vaccines, not direct CDC messaging or specify the nature of conversations that healthcare providers should have with their patients. This might be more along the lines of what the United States Preventive Services Task Force is supposed to do, but their recent meetings have been canceled, so who knows what is going on there. 1A recommendation for the CDC to include several misleading statements in the vaccine information statement (VS), including the incorrect implication that previous assessments of COVID-19 vaccines were based on bad data and several unfounded claims of risks associated with the vaccines. This refers to a bizarre set of exchanges that required the Nobel laureate, whose work led to mRNA vaccines, to publicly opine on the matter. This vote passed 11-1, but will have no immediate repercussions since the CDC has to act to change the VS, and it is a pretty involved process. 2A recommendation that state and local government require prescriptions for COVID-19 vaccines. This is something that is outside the ACIP power, which did not stop the committee from voting on it. Fortunately, this vote did not pass. It was 6-6 with Dr. Martin Kulldorff, the new ACIP chair, breaking the tie with a no vote. 3 an aspirational statement about what ACIP thinks doctors and patients should discuss with no real practical meaning. This passed unanimously. 2 in some ACP passed 2 recommendations that fall outside of its legal purview and narrowly defeated a third. Professor Reiss said these were aspirational with no practical import in any case, but it was painful to watch the fact that 3 of the 4 votes that ACIP took on Friday were policies that were not concrete actionable directives. For example, the committee actual responsibility was frankly absurd to watch unfold. Final thoughts. 3 final observations. First, there was a lot of nonsense at this meeting, almost too much to keep up with at Gish Gallop. So if you would like to see some excellent fact-checking carried out by some outstanding trusted science communicators, the Evidence Collective, please take a look at this excellent PDF ACIP fact check. Second, some infuriatingly amateurish conversations about COVID-19 took place. In one, somebody resurrected the old falsehood that most of the people who died in hospitals during COVID-19 waves who tested positive for the virus died with COVID-19, not from COVID-19. This claim is used to suggest that COVID-19 was far less deadly than is commonly believed, that we overcounted COVID-19 deaths. That is precisely why I assembled a team of researchers to assess all-cause excess mortality during the pandemic. Guess what? During the emergency period, COVID-19 waves repeatedly matched with historic rises in all causes of mortality, as I described carefully here. So to see this dog resurrected at a CDC vaccine meeting was, let us say, nauseating. Lastly, I want to return to the issue of the evidence to recommendation framework, a process by which CDC experts graded various types of evidence during the workgroup phase of ACIP. That is, in normal times, the simple idea was that for every scientific question there were very many research manuscripts to assess, but not all of them are equal. Some are so bad that they should not even be included in CDC briefing documents. Some are okay, but not ready to be used decision-making, including animal studies. But since the Secretary RFK Junior new ACIP first convened, that norm has been completely abandoned. Last week, we saw an amateur hour in place of the pinnacle of months of work wherein only the very best information would be presented to the American public. For example, the old way. Sadly, this is the kind of drivel we can expect to confront in forthcoming ACIP meetings. Nobel laureate Dr. Drew Weissman summed it up incredibly well. What these people do is that they search, they find one paper or 2 papers that make an outlandish claim based on bad data that hundreds or thousands or tens of thousands of other papers refute. They do not mention everything that refutes it. Someone give that man a Nobel Prize. Oh wait, they already did. We can expect more of the same from the new ACIP. That is, until Trump does the right thing by firing Secretary RFK Jr. and restoring genuine expertise to the committee. Until then, as we published in MedPage Today, ACIP is indeed obsolete. 2 Climate Week, as the United States pulls back excerpts edited by RAWSEP for brevity and clarity in relationship to residents against with smoke emission particulates, a 501c3 nonprofit organization. Climate Forward, September 22, 2025, by David Gels. It is the busiest week of the year in New York City. The United Nations General Assembly this week draws world leaders and their delegations from around the globe, heightening security, sparking protests, and snarling traffic. Tip: always walk or take the subway if you can. Other events draft off the presence of so many dignitaries, including the Clinton Global Initiative, the Concordia Summit, the Gates Foundation Goalkeepers event, and the Bloomberg Philanthropies Global Forum. It is also Climate Week NYC, a week-long event series in the city, and I will be hosting the Times event on Wednesday, September 24th, the Climate Forward Conference. We have got an exceptional lineup this year, including Energy Secretary Chris Wright, Hilda Heine, President of the Marshall Islands, Senator Brian Schatz, Democrat of Hawaii, as well as many other political and business leaders. Tickets are sold out, but you can see the whole lineup here and register for the free live stream. With so much going on, we are coming to you with this newsletter a day early. The stakes could not be higher this year after another year of record global temperatures and climate fuel disasters. World leaders are confronting not only a rapidly changing planet, but also a drastically altered political landscape. The United States, which just last year had positioned itself as a climate leader under Biden, has now retreated from those efforts under Trump. The U.S. is now dismissing the threats of climate change and promoting fossil fuels. Trump will address the United Nations on Tuesday. 3. These patients got the cure, then it went away. Gene therapies for rare diseases are frequently developed, but then discarded by drug companies because they cannot afford to produce the treatment for more patients. Tracy Atterbury, a software developer from Lincoln, Nebraska, at the National Institutes of Health in Bethesda, Maryland, where he was treated for chronic granulomatous disease. These patients got the cure, then it went away. Excerpts edited by RAWSEP for brevity and clarity. And relationship to residents against wood smoke emission particulates, a 501c3 nonprofit organization. The New York Times, September 22, 2025. On May 26, Tracy Atterbury checked into the hospital at the National Institutes of Health in Bethesda, Maryland. The 57-year-old has an ultra-rare inherited disease that hobbles his immune system so that the most innocuous of germs could kill him. Now he was going to receive a potential cure in the form of a gene editing treatment that had never before been tried in patients, but in a tale that gene therapy experts say is too common. Atterbury and one other patient, a Canadian teenager, may be the only ones ever to get this treatment, as has happened over and over when gene therapies are developed. The company that made it, Prime Medicine, is no longer offering it. The problem is economics. The science is there to cure the Atterbury condition, a subtype of chronic granulomatous disease or CGD, but it costs so much to develop a treatment and get it approved that even when a company decides to start along this path, it often abandons the effort. In part, that is because there are so few patients. Only about 200 people in the United States share the Atterbury genetic condition, according to the Prime Medicine Chief Medical Officer Dr. Muhammad Asmal, but only about 50 of them might be eligible for gene editing. Dr. Asmal said a 48-year-old woman of Rincon, Georgia, has had a raft of life-threatening infections and tissue damage caused by the disease. When she heard about the Prime Medicine gene editing study, she was excited. Then I found out it was canceled. She said, "I wish the FDA would listen to the doctors." She said, "Can you not help us?" Headlines: The Guardian, September 23, 2025. Pennsylvania official faces threats over post misconstrued as Charlie Kirk killing celebration. Charlie Kirk shooting. The Guardian. RH. RAWSEP. American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Trump attacks Tylenol as officials unveil highly contentious conclusions on autism. Trump administration. The Guardian. TV star Democrat Jimmy Kimmel is coming back. It is proof that you still have power. Robert Wright. The Guardian. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. An Australian reacts as a pediatrician. I want Australians to remember that paracetamol is a safe medication to use during pregnancy. Mike Freelander. The Guardian. Trump Kirk actions. The Guardian. View on the Trump hate for opponents practicing politics the wrong way. Editorial. The Guardian. Trump wants U.S. attorney to punish Trump enemies. White House aide sworn in as interim U.S. attorney after Trump fired predecessor. Trump administration. The Guardian. Australia. Both are at the UN summit. How does Anthony Albanese really feel about being snubbed by Trump? Fiona Katauskas. The Guardian. New Zealand loosens residency restrictions as record number of citizens leave New Zealand. The Guardian. United Kingdom. Corbyn and Sultana. The needs of the left are greater than any of your differences. Owen Jones. The Guardian. United Kingdom. Europe has lost one superpower ally. Can it afford to be in the crosshairs of two? Natalie Tochi. The Guardian. United Kingdom. From dark academia to medieval core fashion is embracing our need for escapism. Lauren Cochrane. The Guardian. United Kingdom. I have seen the Labour cursed deputy leader roll up close. It should finally be abolished. Richard Heller. The Guardian. United Kingdom. The populist right wants to remake the UK in the image of Dubai. We should all be careful what they wish for. Jonathan Liu. The Guardian. United Kingdom. Yes, a working class woman will be the Labour next deputy leader, but what about those still sidelined? Jennifer Jasmine White. The Guardian. China. I took my daughter on a holiday to Hong Kong to visit family. I did not realize how hard it would be to leave Lucille Wong. The Guardian. Headlines: The New York Times, September 23, 2025. Aviation. NASA picks 10 new astronauts as focus shifts to the moon and Mars. The New York Times media TikTok deal could make Oracle founder Larry Ellison a new kind of media mogul. The New York Times media. U.S. asked judge to break up the Google advertising technology monopoly. The New York Times. Michigan satellites and drones are unlocked. Benefits hidden in plain sight in Michigan. The New York Times. Musk. The Elon Musk father Errol Musk accused of child sexual abuse. The New York Times. New York City mayoral race. Mamdani lands endorsement from Kamala Harris, his biggest, yet. The New York Times. RH. RAWSEP. American Healthier. 6 sources of protein that are not meat. The New York Times. RH. RAWSEP. American Healthier. 7 ways to improve your heart health. The New York Times. RH. RAWSEP. American Healthier. 35 simple health tips experts swear by. The New York Times. RH. RAWSEP. American Healthier. Trump approach to pollution. Defense Department delays cleanup of forever chemicals nationwide. The New York Times. RH. RAWSEP. American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. FDA to relabel leucovorin for autism treatment. The New York Times. RH. RAWSEP. American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. For Trump, who has strong feelings about autism, the issue is personal. The New York Times. RH. RAWSEP. American Healthier. How to treat iron deficiency. The New York Times. RH. RAWSEP. American Healthier. Improving your sense of smell is good for your brain. The New York Times. RH. RAWSEP American Healthier. Wind farms can paint the blades a color that deters birds from flying into them. Illinois Chicago McCormick Place in Chicago is helping to reduce bird deaths. The New York Times RH. RAWSEP American Healthier. Solar Power Nevada is all in on solar power. The New York Times RH. RAWSEP American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Opinion that was shocking. 4 experts react to the Trump autism announcement. The New York Times RH. RAWSEP American Healthier. Quiz: how much do you know about fiber? The New York Times RH. RAWSEP American Healthier. Surfing exercise. Ron Domena, Ron John Surf Shop founder, dies at 88. The New York Times RH. RAWSEP American Healthier. RAWSEP concedes that red light therapy tightens skin and wrinkles and does not necessarily make a person healthier. The best red light therapy device reviews by Wirecutter RH. RAWSEP American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Trump issues warning based on unproven link between Tylenol and autism. The New York Times RH. RAWSEP American Healthier. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Trump targets Tylenol and vaccines, and ABC brings Kimmel back. The New York Times RH. RAWSEP American Healthier. Clean energy of hybrid electric vehicles. HEVs. Volvo to expand car production in South Carolina. The New York Times. Real estate brokers. Nationwide Industries consolidated Compass to buy top rival, further condensing brokerage industry. The New York Times. Rhode Island. The Block Island wind farm had unexpected benefits. The New York Times. TV star Democrat The Jimmy Kimmel Show to return to ABC on Tuesday night. The New York Times. TV star Democrat politicians and celebrities weigh in on the Jimmy Kimmel return to late night. The New York Times. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. What to know about Tylenol pregnancy and babies. The New York Times. Trump distraction and waste of our taxpayer money. Trump signs order targeting Antifa movement. The New York Times. RAWSEP interjection. Logically, an individual being against fascism is a humanistic point of view and a view that supports all people except the fascist leader himself. Logically, there is no political movement which calls itself Antifa. Logically, our U.S. tax dollars should not be spent fighting an Antifa or anti-fascist political movement that does not exist. Trump fires Federal Trade Commissioner. Supreme Court allows Trump to fire FTC Commissioner. The New York Times. Trump Kirk actions. I hate my opponent. The Trump remarks at Kirk Memorial distill his politics. The New York Times. Trump Kirk actions. Opinion Christianity after Charlie Kirk. The New York Times. Trump Kirk actions. Opinion. The Trump Vengeance Tour is coming to a stadium near you. The New York Times. Trump Kirk actions. Opinion. The Trump malice is not an instrument of the plan of God. The New York Times. Trump at United Nations this week. Trump to address UN as he jettisons aid and recast U.S. role. The New York Times. Trump uses U.S. attorney to punish Trump enemies. Halligan. The Trump chosen prosecutor takes over Comey and James cases. The New York Times. Universities. Trump influenced universities for the worst this year. U.S. news rankings are out after a tumultuous year for colleges. The New York Times. Wisconsin. They are small, but they are mighty. Meet the Wisconsin sisters healing the land. The New York Times. Norway. How Norway adopted new tech in its hunt for missing oil. The New York Times. Syria. The many faces of the Syrian president. Ahmed al-Shara. The New York Times. China and the United States in rare. China visit. U.S. lawmakers call lack of military talks dangerous. The New York Times. Headlines. The New York Times. September 22, 2025. Computer chips and artificial intelligence industries. NVIDIA to invest $100 billion in OpenAI. The New York Times. Media. Amazon faces trial on FTC charges related to Prime service. The New York Times. Media. American investors will license and oversee the TikTok U.S. version. White House says. The New York Times. Media. Google. U.S. asked judge to break up the Google advertising technology monopoly. The New York Times. New York City mayoral race. Mamdani cancels WABC town hall to protest Kimmel suspension. The New York Times. New York City mayoral race. The wary, warming, wildly consequential alliance of Ocasio-Cortez and Mamdani. The New York Times. RH. RAWSEP American Healthier. Music running marathons. Example of a singer. Harry Styles finishes Berlin Marathon in under 3 hours, and a false name. The athletic science and medicine cures taken away because they cost too much and cured only a select small group. These patients got the cure, then it went away. The New York Times. Surfing exercise. New York City Queens. At a Queens surf school, the confidence of kids comes in waves. The New York Times. Trump Kirk actions. 12 emotional hours. A full day of a spectator at the Kirk Memorial without caffeine. The New York Times. Trump and Federal Reserve temporary Trump placeholder. Miran says interest rates should fall to 2.5% this year. The New York Times. Trump Kirk actions. Opinion forgiveness and fury at the Kirk Memorial. The New York Times. Trump Kirk actions. The firing of educators over Kirk comments follows a familiar playbook. The New York Times. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Trump announcement said to focus on unproven link between Tylenol and autism. The New York Times. Trump distractions and stupidity on display. Trump autism and Tylenol against science and research. Trump live updates autism report expected to focus on a common painkiller. The New York Times. Trump budget cuts to programs for the poor and middle class to fund tax breaks for the rich. The Trump tax cut is underwater. Can a refund boom save it? The New York Times. Wind power. Rhode Island judge says work on Revolution Wind can proceed for now. The New York Times. Croatia travel 36 hours in Zadar. Croatia things to do and see. The New York Times. India reels from the Trump H-1B visa fee. The New York Times. China. How the Trump approach echoes the China crackdown on dissent. The New York Times. Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's corner strategy with Tiger and Leone. She gave us a list of internet allies which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American. Heather Cox Richardson. Substack your local epidemiologist. The Midas Touch. The Guardian. The New York Times.
One introduction. RAWSEP view. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions. Yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom. The Eco-Design Wood Stove and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP view. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.